Namaste, this is Aparna, and today I'm going to talk about antenatal care and antenatal education. I live and work in Ireland. I'm a qualified midwife. I'm also a qualified and certified antenatal educator in Ireland. And this topic is going to cover about antenatal care and antenatal education and its importance. And in today's session, we will talk about the main objective is a good fetal and maternal outcome. So we want to prevent maternal mortality and maternal morbidity. And that's why this topic I have selected. A lot of maternity and midwifery students are looking for this information. So hope they will find this video helpful, especially if you are a qualified midwife and you're planning to prepare a class for mothers. So this can be quite useful for that also. There are many contributing factors in today's society which lead to pregnancy complications, but by receiving a good antenatal care, we can prevent pregnancy complications and we can encourage women to look after their own body and mind. So let's look at some of the factors that are responsible for pregnancy complications that are increasing age for childbearing. A lot of women are leaving to become pregnant until the age of 35, 40, and that's not the ideal time for pregnancy. On the other hand, some women or girls from lower socioeconomic strata or unplanned pregnancy are ending up with a teenage pregnancy. So that can also lead to problems. And women who have pre-existing maternal disorders like diabetes, high blood pressure, cardiac disease, and if they didn't plan their pregnancy well, they may end up facing some pregnancy complications. And multiple pregnancy, so if it is a twin pregnancy, triplet pregnancy, that can also lead to pregnancy complications. If there is a poor previous obstetric history, so if a woman had a difficult birth or a forceps birth, or a bad third degree tear, then she can also face these problems in next pregnancy. Or if she is rhesus negative and she didn't receive NTD, then all of those things can cause more problems for future pregnancy. And then assisted conception as well. So those women who are choosing to become pregnant with IVF, their pregnancy can also be more at risk. So in Ireland, we have a maternity and infant care scheme. So in this scheme, they do combined care between the maternity hospital and with doctors in maternity hospital. So this can be 6 visits free with GP and 6 visit in the maternity hospital. And in India, it is different. In India, what happens is that women register with an obstetrician, and that obstetrician is liaised with one of the maternity hospitals, or she has her chosen place where she normally would conduct births for those women. So let's discuss these antenatal care plans and antenatal education plan in a slide. So I'm going to share my slides now. Okay, let's start from the beginning. So this topic can be more empowering future nurses and midwives and making them aware of their vital role in antenatal care and education in maternal and fetal health. And I delivered this talk for BRD Medical College Gorakhpur just now. So I'm recording it for the students and a lot of other faculty members and staff that attended this talk just now. So let's talk about key messages for antenatal care is ensuring a healthy outcome for the mother and her baby. We must register every pregnancy within first 12 weeks. So first trimester registration is extremely important. We have to track every pregnancy by name for provision of quality antenatal care, skilled birth attendance, and postnatal services. In India, it is important that every woman must get at least 4 antenatal visits. And this includes the registration and first antenatal care in the first trimester. And same thing in Ireland. In Ireland, every woman must register in the first trimester. And every woman should receive tetanus toxoid injection in India. And they always get iron folic acid supplementation in India as well. And we need to test the blood for hemoglobin and urine for sugar and protein at every visit. We need to record their blood pressure. We need to check their weight at every visit. So, what happens is when a woman comes to maternity hospital or to her obstetrician, they get their first visit where they are given a detailed medical history chart. So, they need to fill out or explain what happened in the past. And then their weight is checked, their blood pressure is monitored, their urine is checked, which is done in every visit. But what is different in the first visit is their detailed serology. So blood test is done for a lot of different things, which we will talk about in the next slide. And also we will talk about the maternal history that is taken in the first visit. We need to advise and encourage the women to opt for institutional delivery in India. But in Ireland, that's not the case. We are happy if a woman chooses to give birth at home, and we have to maintain proper record for better case management and follow up. And we encourage women not to take any unprescribed medication during pregnancy. So the component of antenatal care, according to Government of India guideline, is few primary steps is to ensure early registration and see to it that the first checkup is conducted within the first 12 weeks. Track every pregnancy for conducting at least 4 antenatal checkups, including the first visit for registration. And we need to administer 2 doses of tetanus toxoid injection, provide at least 100 tablets of iron and folic acid. And it is very important to take a detailed history and calculate her expected date of delivery. And when I talk to my clients, it is always a little bit of confusion for them that how I only ovulated 2 weeks after my first menstrual period. So how am I in that many weeks? So for calculation purpose, expected date of delivery is always calculated from the first day of your last menstrual cycle. Then there are some essential components of every antenatal checkup. That history has to be taken in the first visit, physical examination has to be done in the first visit, but in every single visit, blood pressure is measured, weight is checked, and we keep checking the fundal height to see where the baby is. And if she is over 20 weeks, then we also listen for fetal heart sound and carry out laboratory investigations if necessary. So if woman looks more pale and we think her iron levels should be checked, or if she is estimating bigger than her gestational age, then she should be checked for diabetes. If there is a family history of diabetes, then we check her diabetes levels as well. So components of antenatal care also include some desirable components, which are checking the blood group, rhesus factor. So if a woman is rhesus positive and her partner or husband is rhesus negative, it doesn't matter. It's only if a woman herself is rhesus negative, then it does matter, because we do not want her rhesus negative group, blood group, to mix with a baby that she's carrying. If that baby is rhesus negative, mother is rhesus negative, no problem. If mother is rhesus negative and baby is rhesus positive, and if their blood mixed up during pregnancy, then it will become a problem for future pregnancy. So we need to test that. And those women who are rhesus negative, they can get NTD injection at 28 weeks or at 32 weeks as well. So we need to check the blood sugar level, carry out the hepatitis B surface antigen test, We need to provide good antenatal education during pregnancy. We need to help the women to plan and prepare for birth. This should include deciding on the place of delivery, where would she like to give birth, who should be present at the time of birth, what are the advantages of giving birth in a maternity hospital, and what are the risks involved in home deliveries. These must be discussed whether you are in Ireland or India or in any other part of the world. Advising the women on where to go if an emergency arises, and how to arrange for transportation, money, and blood donors in case of an emergency. We need to educate the women and her family members on different signs of labor. So, how would you recognize that whether she is going into labor or not? Not every pain that you get in pregnancy means that you are going into labor. The labor pain is very specific, that it comes and it goes, and the whole abdomen will become hard. So we need to educate family members and women on the signs of labor. And we need to inform women about breastfeeding, the importance of breastfeeding, how it can change the entire trajectory of the life of that child if that child was breastfed or not. So it is very important to educate mothers about the importance of exclusive breastfeeding. But on the other hand, if it is not possible, then what is the best next alternative? Warn women against domestic violence, because there can be some cases when woman is pregnant, and if she's facing domestic violence, it can be harmful for her health, her own mental health, and baby's health as well. And we need to promote family planning, especially in India. Government is promoting only one child policy, but we can explain that even if she's planning to have another baby, how important it is to keep a gap of at least 3 years. So early registration is important. Timing of the first visit and registration is extremely important. Women should be encouraged to register within 8 to 12 weeks of pregnancy, so that they can get a good planned antenatal care. And every woman in the reproductive age group should be encouraged to visit her healthcare provider if she believes she's pregnant, especially women who are planning their pregnancy. They're not pregnant yet, but they have any pre-existing medical disorders like high blood pressure, cardiac disease, thyroid disorder. They should be encouraged to register with their doctor and discuss that they are planning to become pregnant, so their medications can be prescribed what is suitable if in case she got pregnant and she is on those harmful medications. So that's why it can be avoided. Ideally, the first visit should be in the first 12 weeks. However, even if a woman comes late in pregnancy, we still have to register her and provide her good care. It's also important how many visits. So, in a country like India, where the population is huge, we ensure that every pregnant woman make at least 4 visits for antenatal care, which is first visit before 12 weeks, second visit between 14 and 26 weeks, third visit between 28 and 34 weeks, and fourth visit between 36 weeks and term. But that doesn't mean that if there is any problem, she can't go to a doctor. So if she's bleeding, if she has abdominal pain, if she's not happy with the baby's movement, she must report and visit the doctor. But in Ireland, there are 6 visits for GP and 6 visits for maternity hospital. So we encourage women to attend all 12 antenatal visits. Now I'm going to talk more about how to design your antenatal classes. So it's important that we look at the evidence of antenatal education, and evidence shows that arrival of the first baby is a very exciting and a unique time. Expectant parents are information hungry. They want a lot of information. Pregnancy, labor, and giving birth is a journey, and parents expect consistency in the information. So if I'm providing antenatal education, or you are providing antenatal education. We all should be covering the same components. Fathers have very important role to play, so we must not ignore the importance of father in an antenatal education. And this is according to NHS. Where to begin? How do we start to plan antenatal education? How do we start to design our antenatal classes for our beautiful mothers and fathers who are expecting their first baby or subsequent baby? But obviously, for first baby, your antenatal class is going to be more important, and they are more likely to be engaging with you to learn. If you expect a ready-made antenatal class, I'm sorry, but you're going to be leaving disappointed, because I'm not going to give you a ready-made antenatal class. But today I'm going to encourage you to plan all those activities, to get the tips so that you can plan your own antenatal class. If in case you want a ready-made antenatal class, I can do that, but there is a charge. I am a expert antenatal education provider. So if you are willing to pay the price, I will design an antenatal class for you. The aims and objectives. So philosophy of antenatal education, we have to realize that when did it start, how it started. I mean, probably it starts at home. So your mother starts to teach you about what she did, how she improved her diet when she was pregnant. She started to listen to more nice and calming music, so she's teaching you. Whether it is an education or is it a part of a clinical care, that's a good question. You have to ask yourself. And how do you devise learning outcomes for the expectant mothers and fathers? My aim is to equip all future midwives and the midwives who are facilitating antenatal education with skill and knowledge to prepare couples for birth and parenthood. So the objectives of any antenatal education program is to plan a class for couples, not only for mothers, demonstrate different positions in labor, teach them breathing and relaxation techniques, explain them the principles of adult learning, describe various teaching and learning strategies, discuss how to handle difficult topics in class, list parenting activities for class, and evaluate antenatal classes. So it is an evidence-based practice. Studies of childbirth education have universally actually failed to take into account the quality of the education. So what kind of antenatal classes they are getting? So families, are they getting good quality antenatal class, or is the antenatal class meeting their needs or not meeting their needs? So that's why it is important that when we are devising the learning outcome for the antenatal class, we have to involve parents into that, information giving and education in pregnancy. So are we just simply vomiting all the information and doing a PowerPoint presentation and saying that it's an antenatal class? No, it's not. It has to be a skill based, activities based learning workshop. So, a review of qualitative studies that was done by Mary L. Nolan. She sought to determine which educational approaches are most welcomed by women and most helpful to them in learning about labor, birth, and early parenting. So, findings confirm that women prefer a small group learning environment when it comes to learning about their birth and parenthood, so that they can talk freely with each other and also with the educator. So I would say maximum 20 to 25 women or couples would be enough for an antenatal class. So we have to use Gibbs reflective cycle model, because it takes into account the adult learning principles, language and communication, what kind of language you will be using. We can reflect the parents' point of view. We can reflect in action, reflection on action. So, what happened? What were you thinking and feeling at the time? What was good and bad about the experience? What sense can you make out of that situation now when you're analyzing? Then we conclude and we find out what is good for the class, and then we include that again. So, there is model 9 instructional event. And in this model, what happens is adapting elements of Gagne's model, which is 9 instructional events. So when you're facilitating your antenatal class, you have to get the hooks into the learners. How do you get that? What do you say that gets you hooks into the learners? And it is very important to inform the learners what are the objectives for today's class. And it's not only the objective that you have set out to deliver, but what are their objectives for this class. Stimulating the recall of prior learning. So any woman, she must have held a baby at some stage, she must have changed a nappy, she must have seen other babies. So let them recall all that prior information. Then present them some stimuli and keep providing learning guidance. Eliciting performance. So make it a class where they have to physically do something in the class. Keep providing them feedback. So, like, so for example, we use babies that are, babies who are, who can cry like a real life baby, babies who can pee like a real life baby. So using them and assessing performance, enhancing retention and transfer. So these are all important 9 instructional events. So if you are planning to deliver an antenatal class or antenatal workshop, then you have to set up a labor practical workstation. And again, I have tips and tricks how to make it really good and how to mimic the water that goes through a balloon and things like that. So you create a breath awareness table, birthing ball, massage. How do you massage a baby? How do you massage a mother? Relaxation techniques. And talking about endorphins, what happens when endorphins run in the brain. And we also encourage women to dance throughout the pregnancy. We also encourage women to participate in things like laughter yoga so that they learn to be happy, listening to some positive mantras and doing yoga exercises. But even though we will talk about all that, but the truth is that some pregnancies or women who are going into labor, they have to use some medications in labor. So medication approach to labor is TENS machine. So TENS machine can be brought from pharmacy and it can be applied in the first stage of labor. It is extremely effective in the early first stages of labor. Then pethidine can be injected in the first stage of labor as well. But if woman is, it can be more effective in the late first stage of labor. And then Entonox, which is the nitrous oxide that can be given for pain management, can be also very effective. In Ireland, in every labor room, there is an Entonox where women can inhale in and out in that mask, and they inhale nitrous oxide. It can make their head a little bit woozy, but they find some good pain relief. Then epidural. Epidural injection is given in their spinal column and in the epidural space, and that gives them complete pain relief, and they don't experience any pain at all. And when you are planning to deliver your antenatal class, you must include the importance of pelvic floor muscles and how important role of the pelvic floor muscles is. And especially when the baby is coming out, whether they do or get or not get stitches, it all depends upon, did they do their pelvic floor exercises, did they do perineal massage or not. So talking and teaching about that, and then making normal birth a reality. So encourage women to write a birth plan, and in birth plan she can write that I would like to avail of a shower facility when I'm in labor. I would like to be active and given a yoga mat and a birthing ball during labor. So she can express her wishes, and that becomes part of her medical chart. And medical professionals and midwives have to read that and honor those choices as much as possible, unless medically indicated. And then in um, antenatal class, we show them how baby is born through the birth canal. So the journey through the birth canal. I'll make another video on that, on mechanism of labor. Then we have to allow mother to connect with the baby instantly after birth in cases of normal healthy delivery. So connecting with the baby, breastfeeding, even using the terms like delivery is not a good term, because as my teacher used to say that a pizza boy does delivery. So we say birth rather than delivery. So we don't use the term delivery. Breastfeeding, highlighting the importance of breastfeeding immediately after birth, when in the first hour there is a very high sucking reflux in the baby. So there are some interventions which may be required when woman goes into labor. If it is not spontaneous vaginal delivery, then in those cases induction might be required by using Prostin gel. So you want to educate women about possibility of getting a Prostin gel. You would like to educate them about the procedure called ARM, which is artificial rupture of membranes. You also want to educate them about getting a drip of oxytocin, what to expect if she goes on oxytocin, what are her chances of giving vaginal birth after getting the induction, and what are the chances of her going into continuous fetal monitoring of CTG. Then we also talk about assisted birth. So if she gave birth by with kiwi, ventouse, forceps, episiotomy, so you want to include literature, evidence-based information, and equipment. So if possible in your antenatal class, keep these gadgets, keep the kiwi, keep the forceps if you are delivering in a hospital setting, or show them a picture of what it looks like. Then cesarean birth. So even though it's not ideal, but first of all, encourage women never to choose cesarean section, because it takes a big toll on their bodies. And it is important that they understand that emergency cesarean can happen. It's a possibility for some of them. And after cesarean, recovery is usually slow. Breastfeeding is very hard. So only if it is recommended medically that they should go for emergency cesarean section or planned cesarean section if it is a breech presentation. So educate them, if cesarean happened, what to expect. Women during antenatal period should be going through group yoga and meditation sessions for a healthy body, healthy mind. And thank you so much. So this was only one part of my antenatal education session. I am hoping to record another video, which will be part 2. So if you have seen this part 1, then stay tuned and I will bring another session for you soon. And hope you have enjoyed today's session. And if you have any questions, or you want to know how you can be trained as an antenatal educator, I do provide that training. I can train you as an antenatal educator. I can also provide you a certificate which would be stamped by Ireland India Council. And thank you so much for joining me. And I would look forward to giving you another talk on designing the rest of your antenatal class. Namaste. Thank you so much.